Hello and a big welcome to all of you who are attending our webinar this evening. Our webinar is called Study Your Public Health and Health Promotion MSc Online. And that's the ticket today because we're really proud, super excited to announce the launch of Brunel Online. Some of our campus programs are now being delivered online, starting with two of our cornerstone programs, the first being our wonderful public health program. And no further ado, let's meet our guest for tonight, our course director, Dr. Nana Anokye. How are you, Dr. Nana?
I'm great, Joe. Thank you very much for having me today. And
It was
excited.
fantastic. Fantastic. Now, I visited you this week, actually. It's been a busy week. I came and
Yes.
visited you. Would you like to tell the audience where I visited you this week?
Oh, great. You want me to share that?
Yes,
So,
please.
great. We met in I would say one of the biggest indoor athletic facilities here in the UK. And you might find interesting to note that that's where Hussein Bolt often trains when he's in the UK. So these are state-of-the-art facilities, and that goes to show that Brunel puts its mouth where it's like it's in terms of
Money where its
cost.
mouth is.
So yeah. Actually, thanks for helping me on that. So we've got wonderful facilities here, and it's not just about offering a course in public health and health promotion, but also contributing to how we can support the promotion of health among the population.
Exactly. I mean, I went to this sports center. My gosh, I never felt more motivated to actually get fit myself than being there. I saw some superhuman fit people at the center who are obviously training for some very serious things indeed, and posters all around of Olympic rowers and athletes
Yeah.
and very healthy people indeed. So it's really fantastic to be offering not just a public health program, but health and health promotion. It's these two key
Yeah.
things that I think make us a very unique university to study in. Now, thank you very much for coming to our session today. Our session is a bit of an info session. We're going to kind of discuss some issues in public health. We're going to discuss online learning. I've sent you some questions before just to tell our audience, and we're going to discuss those questions today. It's not an agenda as such, but these are the topics that will be discussed in those questions. We're going to discuss how our program's designed, who it's built for, what are the career opportunities, what do the modules look like, what's the landscape for public health at the moment, why do we need this program now, why is now the right time, and how do you put your best foot forward in your application. And so me and Dr. Nan are going to kind of talk through all of those things for you. Before we begin, can you just give us a bit of an introduction, where you come from and how you've ended up teaching public health at Brunel University, London?
Yes, so thank you very much, Joe. So as been introduced, my name is Dr. Nana Anokye. I'm the director of the Division of Health Sciences here at Brunel, and in this division sits the Masters in Public Health and Health Promotion. I'm also the course director for this program. In terms of how I ended up here, I think it goes to show the diversity of public health in the sense that I started off in Ghana with a degree in economics and sociology, then
Mm-hmm.
moved to Germany for a master's in environmental resource management.
Okay, quite different.
Quite different, and came to Brunel to do a PhD in health economics.
Right, tied all in
Yeah,
together.
yeah, tied all of them together. So, and I think that reflects the uniqueness of our approach to public health and health promotion in that we aim to support you to develop a multidisciplinary focus or approach to have that kind of lenses to issues in public and health promotion. And given the multiple challenges facing public and health promotion, which keeps on changing, quite dynamic in perspective, I think this multi-perspective approach is what we aim to support you to have.
Fantastic. Now, any of our audience members, if you do have a question this evening, if you are watching live, many of you might be watching a recording, but if you are watching live, you can submit a question. So if you have any question about public health itself, about Brunel University, about the course, about what it's like to study online as opposed to on a campus, maybe if you'd like to tell us your story, your journey, or what you'd like to achieve in the landscape of public health. We're not just building scholars here, we're building scholar practitioners, people who can go out in the field and deploy their knowledge. And with our online audience, we have people all around the world, studying at the point of relevance, ready to deploy those skills. So tell us why you're looking to go and take on this Masters in Public Health and Health Promotion. Now, first question that we have for you today, before we go on, by the way, my name is Joe O'Brien, for anyone that missed that, and I'm an alumni of the university.
Yeah.
if I forgot to say that. So so this is a conversation between an alumni and a faculty member today. So I've always still got stuff to learn. Now, our first question today, a very general question about why we have this program. What are the kind of key detrimental factors in public health right now that this program is looking to address?
I will first like to give a bit of background here. So to start with, the course is structured, as I did indicate at the beginning, to be dynamic and to keep abreast with the changes and challenges facing global public health. And this is made possible through wide engagement between the international renowned faculty members and policymakers. So for example, there is a module called Global Public Health. And what this model intends to offer students is to provide them the critical knowledge about addressing contemporary issues facing global public health.
Mm-hmm.
So for this year in particular, you're likely to study conditions like HIV, high threat pathogens like Ebola, and non-communicable disease, which happens to account for over 70% of mortality cases worldwide. Why are we doing this? We're doing this because, as you might know, the most recent WHO report on the 10 key threats facing global public health includes these conditions that I've mentioned. So that's to give you a feel of how we keep abreast through engagement with policymakers, as well as conducting methodologically sound and policy relevant research.
Lovely. Now, our next question that we had for you is about critical thinking. Master's programs, we say, are all about research, are research led. So it's kind of two questions really. The first is, for those that don't know, what's the difference in an undergraduate program and a master's program in terms of what we expect from our students, and how does this course then help those students develop a critical understanding of global public health issues?
Yes, our aim is to take your learnings from the undergrad level to another level, or a notch higher. And we do this from a variety of perspectives and disciplines. So for example, we've got two models: implementing change and health promotion models. And the key aim of these models is to provide both theoretical and practical understanding about the conceptual underpinnings behind global public health policies. And we are conscious that it's not only important to know about the effectiveness of global public health or health promotion interventions, but it's also important to learn about the value for money of these interventions. And how do we do that? We do that through a model called health economics, which essentially will direct or support you to understand the methods used to value and measure the cost and health outcomes associated with these programs. So at the end of the course, you'll not be in the position to measure or assess the value for money of interventions that you might design, but you will also be able to critically examine and appraise evidence when it's put before you. And this is likely going to happen when you are, let's say, involved in some policy analysis, or you are involved in a position that requires you to study evidence and come up with notes for policy formulation.
Lovely. So now that's how we kind of approach teaching people on the course the discipline of how to move into public public health advocacy and positions within the field, and that's how we keep the course current, what the course is focused on. But in terms of our delivery, it's not a campus course, it's an online course. Now, in terms of it being online, what are the kind of benefits of studying this program online as maybe opposed to campus, or even better, who's this program suitable for in that way?
Yeah, I think there are multiple benefits when it comes to online programs, but about five come into mind. So the first one is about flexibility. So I presume that there are many out there who, due to the current job they are doing or due to their plans to probably change direction, might be in need of doing a course to kind of give them the gravitas, or to give them more knowledge about what approach or what kind of direction they want to take. Now, with those people, they may not have the flexibility of doing a face-to-face or on-campus course. So one advantage of doing an online course is to provide you with that flexibility. And flexibility, I know you might be asking yourself, oh, but I've got modules that I'm expected to do at each particular time. So how flexible is that? There is flexibility, and I'll show you how and why. So with the online course, you've got materials related to the modules, and as and when you would like to study becomes your own choice. So you decide as and when you like to engage with the material that has been provided for you. So it's not like a face-to-face course that you have a lecture time fixed from 2 to 4 and you're expected to be there. So one is flexibility. The second thing is about mobility. With the advent of technology, we all use our iPads, or we use our Android phones and all that. And with the online course, you have that opportunity to have the information on your mobile phone. You can take it anywhere you want to go. Or one other facility that we provided along this course is to provide you a PDF at the end of each unit. So at the end of the unit, you can just go download it. And when you are facing challenges with internet assets, you just download it. You can work it with anywhere you go. A third advantage is the issue about engagement. With on-campus course, although you still have access to people from diverse backgrounds, due to limitations with travel and other stuff, you probably wouldn't have as much engagement with people all around the globe as you will have with an online course. So your engagement becomes even much more broader. And then fourthly, one could say it's practical, affordable, and offers you market-ready skills. And the last advantage I'd like to talk about is the issue of credibility. So I'm not going to use the word course because I see ourselves as a family. So the Public Health and Health Promotion family here in Brunel is blessed with academics who are internationally renowned in their respective areas. And what a joy to come and get yourself involved in this family, where you will have access to these academics with diverse knowledge, and also with opportunities to link you up with other networks that you might want to. So in short, I think these are the 5 main advantages that come to mind when you talk about online programs.
Exactly. I mean, I remember I did my undergraduate, obviously, at Brunel. I was on campus, I lived in London. That was the time when I was 23. Now I can imagine, a lot of my alumni, a lot of the people I studied with are now no longer, living in the UK or living right next to Brunel or whatever. They're all over the world. And it's people for our age. I went back and did my MBA online. And it's people, I suppose, a bit older, maybe with children, working full time. I mean, you said, earlier about flexibility. Imagine this course if you're a nurse, or if you're someone working in the hospital, a doctor, you're someone with irregular hours, for example. Yeah. This is perfect because yes, you have a module. It's for a set number of weeks. You have an assignment at the end that's fixed. But how you get there in terms of where you study, you don't have to run to the lecture hall all tired because you got 3 hours sleep the last night from your shift. They don't have any of that. It's fully online. And the people that are working with you and your teachers and tutors and your colleagues are the same. And they'll become your family as well, as Nana said. They understand that, and you'll learn off each other. And I'm sure, Nana, you learn off your students as well,
Definitely.
as much as they do of you in a way. And it's sharing those perspectives. Our online program will be very unique in that it will offer even more of a global perspective than our campus course. It will spread even further wide because of the nature of its delivery. And so it's a very exciting opportunity, which kind of leads us on to our next question of where do our students come from? What's the typical student profile for this course, be it campus or even online, really? And what undergraduate areas have they come from, or work-based areas, if it's not necessarily a program?
Okay, so we have a very diverse student population, and our students usually come from all parts of the world, for example, including Africa, Asia, North, Latin America, and Europe. So this year, I would say majority of our students come from international students, so they come from Africa and Asia. We have students from China, students from Ghana, Nigeria, Pakistan. So it's really a multicultural course. In terms of the professions they work in, professions are very diverse, as public health is. So the professions include, we have doctors, nurses, social workers working in the area of health and social care. We also have people working in local government and people working in education and the voluntary sector. So it's really multidisciplinary or multi-diverse in terms of the profession base. For the first degrees that our students tend to have, this is why. So as you could see, if you have plans of applying for this course, I would say the last thing you need to worry about is your background or your first degree. Because the beauty of this course and how we enrich our programs is to facilitate discussion among people looking at one topic from different backgrounds. So you could be an engineer out there listening to me, you could be a medical doctor listening to me, you could be an economist, or you could be a business administrator. You are welcome to do this course because that is what we actually encourage. We want it to be as broad as possible to enrich our discussions and engagement.
Exactly. It's the space that you're moving into that will bond you all, not necessarily the space that you've come from. You're moving into the public health space. You might already be in that space. You're taking this degree where you're moving into the health promotion and public health space, which is so broad, such a broad remit for the things that you can do. And we'll look at that as well. Now, we're going to look at the program in a minute, but I kind of want to stop on this phase. I like people to think about the end before they start something, because if you're going to take an online degree or any degree, I say it's like running a marathon or mountaineering. People run marathons. I'm not one of them, I must admit. I'm very, very jealous, but people run marathons. They don't start a marathon with no training. They don't do a marathon thinking it's going to be easy. You break it up into bite-sized chunks mentally. You train for it. You prepare for it. You learn about yourself, you learn about your limits, and then you go and achieve that. Now, I see very much a similar parallel with a master's degree. It's a lot self-driven, a lot of research, online learning. You're going to have to do your assignments, do your studying. You're going to have to do that. It's not going to be easy. There's good challenges, but it's exciting. You learn where your limits are. You learn your value, and really, it's about understanding where you want to be at the end. And so a dissertation is a kind of capstone, last phase of the program. And I wanted to talk to you about the importance of that phase, how people can use that to give themselves a leg up within their profession, how they could use it to kind of transfer skills directly to the field. Could you tell us about the dissertation phase and the program, and what is expected of our students in order to graduate?
So the dissertation usually happens at the latter stages of the course, and here I'm talking about the last 15 weeks. And essentially, we call it the research project, in that students are expected to undertake an empirical piece of analysis. And this research project, the beauty of it is a culmination of the intellectual achievements students have gathered on the course. So that's why we expect students to exhibit and demonstrate the key learnings they've learned, both in terms of theory, in terms of practice, as well as to also reflect on their day-to-day work or their past experience, as well as experience they've gathered interacting with their colleagues and others. To complete this phase, or to complete a research project, students are expected to first develop a research proposal, an idea, and we often encourage our students to base this idea on something that they are passionate about, something of public health or health promotion relevance, and obviously something policy relevant. So after they've developed this research question, the students will then apply for an ethics approval. The idea here is we try to support and encourage our students to adopt or to learn the key tenets of conducting research, so that when you go out there, be it as part of your job or be it as part of a future job, you will then acquire the skills to be able to conduct research anywhere and conduct good quality research. And a key aspect of conducting good quality research is ethics approval, ethics consideration. So after you've gathered your ethics approval, then you move on to collect, analyze your data. I know you might be thinking, so Nana, how are we going to do all this? We have a module called a research methods module.
It's hard.
Yes, I usually say it's significant. Significant rather than hard, in the sense that the research methods model has been designed specifically to address all the important learnings of the key stages I've talked about. So the research methods model will first take you through how do you develop a research idea, to make it policy relevant and to reflect your experience, to reflect where you want to go. And in doing that, how do you go about conducting or preparing your ethics application? How do you collect data? And here we're talking about different types of data. So how do you collect primary data, secondary data, qualitative or quantitative data? And we also support you to learn the key skills of conducting analysis of these data. So how do you conduct qualitative analysis? How do you conduct quantitative analysis? Then we take you through the basic as well as the complex stuff analysis that you might need as part of this course. Not only that, after you've gone through the research methods and started your dissertation, the good news is you are not left on your own, because every student will have a supervisor or a tutor that will work with them. And this tutor's aim will be to guide you through the various stages of the dissertation to completion.
That's perfect. Yeah, I mean, the dissertation really is at the sharp end of the course, and it's the culmination of everything you've kind of worked towards. And if you get it right and you pick the right topic, you can actually be using that dissertation for years to come in a way. I remember, I did an MBA, it's a business degree. My dissertation was looking at the flow and quality of business leads for online education providers that came through social media. It's directly relevant to what I do now, and I did that 2 years ago. Still think about the learnings there, and as you said earlier, people use this degree either to progress in their current field, or maybe they're looking to switch fields, or maybe they're looking to start their own business or initiative or NGO. And so really, when you get to that dissertation, that's an opportunity to kind of put that stamp on that direction and take a leap. Now, talking about taking a leap, can you tell us a bit about, maybe some graduate success stories, what your graduates have been doing, in which fields recently, and where our alumni, or where the alumni of the campus course are working?
Yeah, I should say this is, I need to flag up here, conflict of interest. This is my most passionate area, because for me, this addresses them so hotbed. You come in, you do this course, you get all the learnings, you get all the support, and so what. Our graduates, I should say, do very well upon completion of this course. And how do we go about supporting our graduates? We see employability as a shared or a co-owned process. So what we do is that, although I would expect that our students doing the online course may be already working, but as I said earlier, you might have plans of changing directions, or you might have plans of moving a step higher in your current job. So we do this by offering you advice, so you get access to information and advice from career consultants. So people who have been there and are specialists in giving tips about how you can improve upon your career. So this advice you don't only get from the tutors or the staff, the academic staff, but you also get it from career consultants specifically attached to this course. And I'm glad to say that we've got high number of success stories, but I'd like to share a couple with you today. So for example, the current external examiner of the face-to-face course is a graduate of this course.
No way.
And he's currently a professor in international public health in the renowned UK university.
Wow, that's brilliant.
So
that
shows,
academia is another part.
You get academia as another part. Currently, I've got PhD students. I've actually got 2 PhD students who just completed the course last year.
Wow.
Currently working with me. And in terms of policy or other sectors, we've got some of our students working as director of healthcare management services or associate directors of public health and local government organizations, some working as research and development coordinators, etc. And we've got a few also going to work international NGOs, so some working with Oxfam, some working with Public Health England, and working in other countries. So it's, as the course suggests, you are supported to have a multi-perspective approach to understanding public health, and that reflects in the kind of jobs our graduates go away and work in.
That's very good. It gave me a real idea that to answer that question about the seriousness of the course,
Yeah.
in a way, and the seriousness of which our graduates are placed, and in terms of what happens afterwards in their careers. So fantastic to see that people are coming back to Brunel as well, and looking to maybe go on to do academia or PhDs as well. There's a whole bunch of options for you doing, this type of master's course at a reputable university. The world is your oyster. But it's good for you to understand now, before you're heading into the course, some loose ideas of what you do want from the program, where you hope to be. Start those 5-year plans that you might have been annoyed about before, having to do a 5-year plan. Well, you can't be annoyed anymore. You need a 5-year plan nowadays if you're going to do this. So think about where you want to be in 5 years, 3 to 5 years, and this course can help get you there. Had a couple of people come in, a few questions, a few people announcing their names. Sometimes we give a few shout outs, like an old radio program, old pirate radio programs. A shout out to Ben, shout out to Kaylong. We got some people here as well. We got some questions coming in. Also your stories. So what are you hoping to do with the degree, guys? Why do you want to study public health? What are you doing at the moment? Please tell me. Or if you have any questions, write them in now. Don't be too late to get your questions in. Even if they're a bit silly, just send them in and we can address them in a second. Now, this is our wonderful online public health and health promotion MSc. I'm just going to do a bit of magic here so we can look at the program. Here we go. This is on the Brunel website. You just go to info.online. You can go to the Brunel page. You can find us under the study programs Brunel online, and you'll find our public health and health promotion degree here. Study one of the longest running MSCs in public health and health promotion. Now, I just wanted to run through this with you. Now, people can go and do their own reading, but I'd like to hover here, just a bit of hovering, on the modules. And I'd like you just to go through a bit of the logic of why the course is designed like this, and the modules that we've chosen.
Yeah. So a range of disciplines, subject disciplines informs the curriculum. And the reason we do this, as I've been talking about, is to offer students or equip them with advanced skills and to support them develop a multidisciplinary approach to public health and health promotion. And not only that, to also support students link theory to practice or policy. Now, what are the courses that, or what are the disciplines that informs the development of this curriculum? As you could see, we've got global public health, we've got epidemiology, and these giving you different learnings. We've got health promotion, health society, health economics, which I've talked about, the kind of learnings that you expect to get from this. And then we got health policy and politics and justice. So we help you navigate or provide you the information to navigate through how to get policies designed and these policies evaluated, both in terms of their effectiveness and also in terms of their cost effectiveness. And also, in addition, you may also want to understand what are the key drivers for the effectiveness of these policies. What makes these policies thick? We give you that information, and then we top it up with research methods model, which I've talked about, which is to bring together all the things you've learned, allow you or enable you to put them to practical use, to conduct a real life study, to put what you've learned to use. And then also to do this after you've gained these learnings, to do this using your dissertation, where you work hand in hand with researchers or a team of researchers in the area. Now, in doing this, you might ask yourself, so Nana, what kind of skills would I gain at the end of the day? Let me give you a taste of some of the skills that you gain. So at the end of this course, we expect you to have been exposed to diverse methodologies. And here I'm talking about things like statistics. And I know some people may not like the mention of the word statistics because probably they like more qualitative. But we would take you gently through the basics for statistics in terms of practicalities as well as the complex statistics. And then we also take you through qualitative analysis. Not only that, also how to collect data for qualitative studies, and then you'll be given an exposure to media. So how do you communicate the results of your study? Because it's one thing conducting a study, it's one thing getting an understanding of how to approach public health issues, another thing, actually most importantly, how do you communicate this out to policymakers? Because I believe you're all coming on this course to make a difference. You're coming on this course to make an impact. For me, that was one of the key drivers. That's why I came to do public health and health promotion, just to be in a position to contribute to making a difference in the health of the population. And to do this, you need to communicate well. And also you know how to review literature, because let's have a case in point that you're working with an organization. There's been a topic that you like to know more about. You wouldn't want to reinvent the wheel. How do you go about understanding what are the key gaps in the area you're working in? How do you go about knowing that if I've got this topic, how do I go about addressing this topic? You need to know this through the literature. And how do you go about identifying and reviewing the literature in a more credible and scientific as well as replicable manner? We offer you the skill as well. And to top it all, you will then get the skill also to different types of evaluations, be it process evaluation, be it impact evaluation, and being it a cost effectiveness evaluation, which is a unique selling point of this course. You might have realized that not many public health and health promotion courses have a module specifically set on health economics. And that is another skill that you get as a result of this course.
Wonderful. Now, after listening to this, you might be thinking, right, this is the course for me. How do I get onto the course? There are entry requirements. There's an application like anything. You have to get onto the course. What are our entry requirements for our program, Dr. Anokye, and what do we kind of expect from our students in terms of their motivation and their application?
In terms of entry requirements, I think the key point to note here is the honors degree in terms of the grade point. So we're often interested in degrees with 2.2 or above. You might ask, what about the discipline? As I said earlier, for the discipline, so far as the degree is coming from an internationally recognized institution, you will find, because we want to allow a more multidisciplinary approach to understanding public health. So your discipline could be in health promotion, could be in public health, could be in other allied health, health related studies, social sciences, sports sciences, environmental health, even engineering. You are welcome to be part of this course. And there is an example. A couple of years ago, we have one of our students coming from, so they first registered in law and policy area, and then they later transferred onto this course, and they came out doing very well. So that shows you the variety in the disciplines that we encourage. You might also need to, in terms of the qualification, you might also need an IELTS or an English language qualification to show your proficiency in English. And here we are looking at minimum of 6 in other areas. And for a Pearson, we're looking at 58 or 51 in all sub-scores. So in brief, these are the entry requirements that we expect.
Exactly. I mean, even I have a film degree from Brunel, a drama degree, but there are people that that are working in the film industry or who are using drama to promote health initiatives.
Yeah,
there are people doing film initiatives, video content based initiatives, so they can provide the same kind of high quality content that big corporations get, but actually for public health. That's rather underfunded. I don't know what Netflix is. Rather underfunded on the course. Now, in terms of the entry requirements, application document, we expect a completed application form, scanned copies of your certificates, your CV or resume in English and your English proficiency. Now, obviously, if you've studied your undergraduate degree in the language of English and you've written that all out in English, then obviously that's fine. But if not, and if English is your second language, as it will be for many of our students, especially on an online course going as far as we go around the world, then yes, you have to do some English proficiency there. Now, that was our online public health and health promotion MSc program overview for today, and a bit of a chat about the landscape that we had, who our program is suitable for. So a lot of information for you guys out there who are looking at this course. You should really be at the kind of sharp end of making a decision now and thinking logistically, how do I map out my time? How do I deal with studying, support from my family? Would you agree, Dr. Anokye, that support might be the last thing you're thinking about when you're looking at a program and looking to advance your career, but as soon as you start studying, a support network is very important. How do we support our students at Brunel?
We support our students through multiple ways. So first and foremost, students will have access to tutors that they could contact quite regularly, and the response will be in time as well. In addition, you also have access to a team of administrators on board, you have access to your academic staff, and you have access to other related facilities or resources related to well-being, because our interest is about your well-being. And also we care about your employability as well. So for us, we approach our student support from a holistic perspective. Not only the learning students are together on this course, but also how do we support the students to make this learning as less stressful as possible? Because we know that there are other commitments in your life. The other commitments you have to juggle with. So how do we support you to negotiate or navigate this very direction quite successfully? And we don't stop there. We're interested in what you become afterwards. And that is why we bring in employability. And as we say, all our alumni, we expect to also be part of the family, even when they finish. And the case in point is having our external examiner being a graduate on this course.
Exactly, there you go. It all comes around full circle. And I've had a whole bunch of questions, not all questions. Sometimes we've had some statements where people are from. We've got a registered nurse here. South America, we have pediatrician. We have your colleague, Kay Chung, who teaches on the health promotion module, who's here as well, who wishes you their best as well. So some health promotion expertise as well. And a few questions to wrap up the session. So next couple of minutes, we'll take a couple of questions for our audience. We haven't looked at these before, so we'll see what questions we have. It's a good question that we haven't covered here, actually. What is the average years to completion of this master's? Can you have the option to complete a capstone project instead of a thesis? I think in terms of capstone project, it is one. It's a dissertation final project in a certain form, isn't it?
Yeah. So it's a dissertation, but I actually think the better word for this is a research project. Yeah. So you conduct a research project, which our expectation that the output of that could be in the form of a manuscript.
Right.
So you
okay.
write in the form of a manuscript.
And
so the expectation is not to produce a very big dissertation, but to provide something which is concise and something that afterwards, if you have plans of publishing, that you can, with the support of the academic staff, you can publish this. In terms of, I think the first question was about the average years.
How long does it take to complete?
Yeah, for full time we're expecting roughly 1 year, and for part time we're expecting 2 years to complete.
Yeah, I think to be perfectly frank, if you're looking to study this online, I imagine you're working. If you're working 40 hours a week, I wouldn't recommend you try to squeeze this program into a year. You're going to go grey very quickly or bald very quickly. You know, it's a program. You can do 40 hours a week, and then you can also study. Another question here: how many hours a week do I have to study? Someone's asked. Well, that will depend on whether they're doing the program full time or part time. But let's assume the majority of people are going to be working full time, coming home and fitting the study into their evenings and weekends. How many hours do you think, Dr. Anokye, a week do you think you might need to do this? I remember for me, for my master's, online was around 20 to 30 at the deep end of a module, maybe about 10, 15 at the lighter ends of a module.
Yeah, I would say, yeah, it's something similar. And also, I think it depends on other individual factors as well. So I think the encouragement we give to students is for them to engage quite regularly and frequently with the course material. I know it's a 6 weeks period. And actually, if you are to engage with the material a bit more consistently or more frequently, then in a way, it tends to limit the number of hours you tend to spend because you are full on and on top of it. In terms of hours, I think I totally agree with you. You are looking at the range of 20, 30, maximum, I would say about 40 to 50 hours, depending on how you study and how you engage with the material. But as I did state earlier, one innovative bit of this course, or the way this course has been designed, is often at times with online course, the only time you can engage with the material is by going on the web or having access to the internet. We are conscious that there are times that you may not have access to the internet. So after you've gone through each unit, you are given the opportunity, or there is a facility for you to download the material as a PDF. Perfect. Which you can take away. And assuming you're traveling and you've got into an area where you don't have access to the internet,
like many of our public
car, yes, back of your car, you could take a glance at your work. So as we said, we've structured it to support or work around the lifestyle of students as much as
Fitting
possible.
around you out in the field, doing what you're doing, but at the same
Yeah,
time, when you're breaking, being able to just look across, take a bit of
yeah.
learning in. Some great professions here. I have a sports science background and work with health promotion in Ghana. So you're from Ghana as well,
Yeah,
Dr. Nana, that's nice.
yeah.
As a Nigerian, do I need English proficiency? Just what would you say? Not sure
I
about
think
that.
it's yeah, yeah.
Not as much,
I
I would
think it
expect.
depends. Yeah, I think it depends on if your English was in English. I would say just put in the application, and if you have an English proficiency, which usually looking at those, hopefully it still exists. So I finished my first degree in Ghana, and I know those times you could walk up to the administration and get an English proficiency to demonstrate that your course was in English and you've acquired a level of English language proficiency. You can attach that to your application. I think you are ready to go. So I don't foresee it to being a big problem because I presume in Nigeria, the medium of instruction or studying was English. So with an English language proficiency from your administrators or your examination council, I think you are ready and good to go. With a colleague from Ghana, sports sciences background, yes, definitely
You're
this
ready. Yeah.
applies. And you are ready, and we welcome you.
Gabrielle's a registered nurse working in Canada. Currently
Yeah,
work as an educator at a university. There you go.
yeah,
In British Columbia, primarily teaching clinical students. So there you have it.
yes.
So there you have it. What is the average years to complete the masters? We've covered that. Some of our questions are people asking the same question for stuff that we might not have covered. We've kind of covered this in a way, but this is a very nice, direct question from Adefemi here. What are the job prospects and opportunities open after completing my MSc in Public Health and Health Promotion, or direct?
Yeah, so if just to give you an idea of some of the areas that you could work in afterwards. So as I mentioned earlier, you could work in the area of you could decide to work in academia, go on to become a professor. You could also work in organizational development. So here we're talking about developing organizations to be more health promoting, like schools, workplaces, and hospitals. You could also work in the area of community development, where you support developed communities to be more health promoting. And here I'm talking about neighborhoods in Nigeria, culture, communities, etc. You might also decide to work in strategy development, where the key aim is to work with local, international, or national policymakers to design approaches or interventions to support public health and health promotion. And
Perfect.
as I said, we have some of our graduates going into work with Oxfam, some working with Public Health England, which is a national organization, some working with local organizations, or some working as associate directors of public health with Barrows. So it opens a number of doors for you. You could decide after doing public and health promotion to move and become an educator with a university. So there are multiple ways. And I would say the person who asked the question, we are fully aware of this. And we know that this shouldn't be only the headache of the students. It's our headache as well. And we
Nice.
work together with you to support you, not
Nice.
only in terms of thinking about areas right from the beginning where you could work, but also how to make that happen. Because as Joe, you stated that earlier, you did your master's, and the topic you did your master's in is what you've been using to date. That
Yes.
means you are very strategic there. And that is
Yeah.
what we support our students to do. So in your choice of your topic for your dissertation, in the
Relevance.
applications, yes,
Relevance.
relevant topic. In the applications or the case studies you do as part of your submission, we encourage our students to think about where they want to be so that you are preparing the way towards making that happen. And our tutors or the academic staff engage always with policymakers. So they're on top of what are the requirements or the skill set that your future employers would require. And we strive to support you get that.
Exactly. We have some more logistical questions here. Some questions about tuition fees. They're going to differ whether you're from the UK, from Europe, or international. And we have some questions about maybe non-standard applications as well. We have a chap here who's got 6-7 years experience in the public health field and might be coming through on what we call a non-standard. Can interested candidate who does not have a 2-2 grade but up to 5 years of experience in public health eligible to apply. So this is what we call a non-standard application. This is what online learning is all about for me as well. It's about looking at some cases that come from outside the margins that might not have have typically have gone to a campus degree when they're earlier or went straight into the field, might have a bit more experience that way. We still look at each application on its merits. We'll still look at those. In terms of tuition and applications and all the different situations that we're all in terms of transcripts and grades and different qualities of language and everything, we have this fantastic person called an education consultant. They're there for you from the beginning of the program, and they talk to you about whether this course is the right course for you, whether you're picking the right number of years, how to structure that, whether it's the learning outcomes are matched to what you're looking out for your career. They'll take your transcripts, take your background, they'll put that into account. They'll go through the admissions process with you. So those are some questions that they will happily answer. They'll have some deeper dive conversations with you guys about that. So don't be shy. Talk to your education consultant and find out more about your case and how you can put your best foot forward to get admitted onto the program. Each case will be taken on its merit. We make no promises here in a webinar. You'll have to go through that process yourself. But if you're listening carefully and going through everything, you'll be well informed how to do that in the best of ways possible. Also, what I'd say to people, although there are no specific scholarships for online courses, what we did and what I certainly did is I took employer contribution for my course, because I didn't even realize my company had quite a large training stipend that if I applied for, I would get. It wasn't publicly put out everywhere that everyone had this training stipend. Someone told me, do you know that you can get this amount of US dollars per year to go study? I thought, well, if I prove that I'm studying and whatever, I can get that contribution. So you'll find that many of you might have that. There might be grants and things associated with health associations, things to advance their employees so they can move into much needed positions that need filling in a landscape, where it's difficult to fill these positions with expertise. And obviously to get this kind of higher knowledge from a UK university established public health course isn't the easiest thing to do if you're living in a remote part of the world further away from the UK. So this is the course for you, but you'd have to discuss that all. How are we graded, sir? Very good question. How are we graded?
So the grading is out of 100, and you'll see. So we use letters. So in this range from A plus down to we're not expecting. We're supposed to know to achieve that, but down to the lowest grade. So you're talking about A, B, C, D, E up to F.
And that's it's coursework assessment. There's no exams on the course. It's all based on assignments, coursework, and projects.
All coursework assessments. And as part of, so when you start, you'll be given a feel of the coursework. So you have ample time to prepare for that and submit an essay that you're happy with.
Okay, there you go. A question I can answer actually: what happens if, due to unforeseen circumstances, you have to drop out of the course temporarily? Is the course flexible enough to accommodate this? We understand more mature students with busy lives are going to have to juggle a bit. I took a 3-month sabbatical for my course when my wife had a child, and I wanted to be there for the first 3 months and not be up studying whilst at the same time up with him. I don't think I could have handled that, so I took 3 months suspension of my studies, and that's something that I will discuss with you. Again, we treat all our students on a case-by-case basis. We have support. You have people that you can reach out to that you know the names of. You won't be reaching out to info and support. You'll actually know someone. It'll be a John or a Joe or an Amy or someone. You'll know someone there, and you'll be able to reach out to that person and say, hey, I'm going to be struggling with the timing for the next module. I'm going to be struggling with that, or I'm going on a big trip. How do I manage that? So
and to add something to that, so we offer here at Brunel, we offer the facility of abeyance. So students are eligible to apply, presenting their case obviously, to apply for a maximum of 12 months abeyance, and this could be taken in chunks. And we offer this because we are conscious, as rightly the question suggests, that people have different things, unpredictable things coming up, emergencies, and we want to support our students to navigate and have a way around those and not to disrupt their studies. So there is an abeyance facility available for students. Just have a chat with your tutor and they will guide you through how to make the application.
Perfect. The last few questions here. If you're in the UK, can you find funding for student loans company? That's something you're going to have to look at as well directly with the student loan company. I believe last couple of years they have approved online masters deliveries for student loans in the UK, but please look into that. I don't want to make any promises there. Can you study this MSc over a longer period than 3 years?
There is so there is a possibility for there is a maximum registration period, which could account for that. But as I said, as and when the situation arises, we could have those discussions and you know,
Yeah, I mean, when I studied the course, it was
us,
3 to 5 years. I finished
yeah,
mine in 3. Some people took up to 5. We recommend,
yeah,
I would recommend for anyone studying is to keep the pace going. Do a module, take the break. Do a module, take the break. Keep the pace going. There might be one time where you want to drop a module because of, as we spoke about earlier. But really, you know, it's 2 years. You maybe can stretch to 2 to 3 years. What are the dates of the program start? I believe our program is starting September.
yes,
So
coming
there you
live in
go.
September. Yes.
In September, there you go. And a question I don't understand, which might be something to do with public health. Can you opt out with PGD or PDC? Do you understand that question?
Yeah, PG sets, PG. So yes, a PG dip. So it depends on.
Oh,
So there are
postgraduate diploma or
yeah
postgraduate
postgraduate
certificate.
certificate. Yes.
Okay,
Yeah. So there are those intermediate awards, as we call them, that you could
okay.
opt out of the course with, depending on it will be assessed by the exams board as well as the exams panel, and the decision will be made. But yes,
Yeah.
in theory, that could be
Here,
achieved.
yeah. And we're a university, a top university in the UK. We're governed by the Quality Association, the QAA. Most of the rules that apply to universities in the UK will apply here in terms of degree durations, times. They're all set, kind of. They're very formula set. You can't take forever to do your degree. That's something that QAA established and put onto universities, saying a degree that's relevant. When you're studying the relevant skills, the course will need to be redesigned X amount of years. The amount of time you take the program will have to be X amount of years. And that's kind of a governing body that looks at that, an external subjective body. And that'll look at that with all of the universities. So you'll find that across the board. And the last question, which I think is a good question to ally, you know, some people who might not maybe understand or be familiar with online learning as much, is my certificate recognized?
Oh yes.
It's not a, first of all, it's not a certificate.
Yes.
It's a
It's
full-on
more than that.
master's degree.
Yes. It's more than that. And it's not even the paper. So you get recognition for that through a qualification, a master's degree qualification in public health and health promotion. In natural sense, you're no different from somebody who will do this course face to face or on campus. And in addition, all the learnings, all the networks that you can tap into as and when you would like to. So yes, short answer, you have a qualification which is recognized coming from a top university, being one of the longest running courses in public health and health promotion.
Exactly. And when we all see you in a couple of years, when I see you in a couple of years at graduation, standing next to the campus students with the same degree,
Waving.
I might find, as I often do, I find it hard to tell who's studying on campus and who's studying online. But I try to say maybe a bit older, maybe a bit more diverse. But even our campus program is very diverse indeed.
Yes. Yeah.
So yes. We've covered such a wider range of questions. We've almost gone for an hour today in our info session. I hope that people enjoyed it. We had a big audience of people from around the world, from North America. Thank you for tuning in the morning. From Africa, thank you for tuning in the evening. If you're from Asia, wow, you're committed. It's like 3 or 4 in the morning over there. So thank you very much for that. And for all of you watching the recording, thank you very much for tuning in as well. My name is Joe O'Brien. I'm alumni, and I'm very proud to be involved in this program. And thank you very much, Dr. Nana Anokye, for your help as well, for discovering all of the things that we can do with an MSc in Public Health and Health Promotion online. Thank you very much.
My pleasure.
And goodbye to everyone tonight. I wish you all good luck. But if you're listening, you won't need any luck at all. So we'll see you all in class. Thank you very much. Goodbye.
See ya. Bye.
See you. Goodbye.
Bye.